and we'll spend some time taking command and control of the situation that is before us in our fight against COVID-19. It is time for us to have a collective course correction, to make sure all of the work that we've done, the days and the weeks and the months of contributing to saving lives was not for nothing, that we make sure that our loved ones stay alive, that our economy stays open, and that we keep our focus looking forward, even in days in which we are exhausted, tired of this disease, want it to be done. It is now time for us to act, and act together. We have to deal with the truth. COVID-19 has never left us. It is still here and is still as dangerous today as it was day one when it arrived. This weekend, we crossed a number of sobering thresholds, milestones that reminded us of just how dangerous things are. Around the world, 10 million human beings have now been confirmed to have contracted COVID-19, and 500,000 human beings have died at the hands of this disease. Here in America, the numbers are proportionally even worse. 2.5 million Americans have been confirmed of contracting COVID-19, a quarter of the worldwide cases, and a quarter of the worldwide deaths now. 125,000 fellow Americans have perished at the hands of this disease. Here in the county of Los Angeles, we passed another threshold as well, adding 2,903 new cases, a staggering number just from a few weeks ago, bringing our total over 100,000 diagnosed positive COVID-19 cases at now 100,772. Here in Los Angeles County, we account for 1 out of 100 positive diagnosed cases of COVID-19. Now, we know around the world many places don't have the testing capacity that we do. We know that that 10 million estimate for human beings around the world is probably grossly underestimated. But still, these are sobering numbers that should be sobering for each one of us. And we should ask ourselves what we can do to win this fight and to make sure we save lives. The United States accounts for 4%, a little bit over 4% of the world's population, and we're 25% of the world's diagnosed cases. That might be something we could dismiss as, well, we have more testing, we're a richer country, more people have access. But deaths don't lie, and we have a quarter of the world's deaths to date from COVID-19. Let me restate it. It is time for a collective course correction. It's time for us to take control of this moment, because I feel that COVID-19 is beginning to take control from us, but we can do things to take control back from COVID-19. And I'm counting on each and every one of you to do just that, for yourselves, for your family, for your neighborhood and your community, your workplaces, our city, our country, and our world. And the next 2 weeks will be critical weeks in defining whether we can do just that. When the history of COVID-19 is written, there will be many important moments. The moment LA acted first, whether it was with face masks or closing things down, whether it was moving forward with testing for everyone, we have been a place that has not only influenced this country, but this world in a fight against COVID-19. But this period will be our second big test, to see whether or not we can do the things, all the wisdom we have learned, to collectively apply that, and to make sure we do our part to keep people living and to keep livelihoods moving forward. Today, the county shared that it is estimated that 1 in 140 people in Los Angeles County is currently infectious with COVID-19. Over the coming week, it is estimated that will fall to 1 out of 100, or even 1 out of 70 residents of LA County. Think about that for a moment. When you go to a grocery store where hundreds of people will go through in a given day, it means we are closer and closer to people who are infectious. I think the longer this went on, and if you were lucky enough not to be affected by it or have a loved one affected by it in any bad way, we've kind of begun to assume that everybody around us isn't infectious. But remember at the beginning of this when we assumed everyone was? We have to return to that, especially with strangers or people who are not part of our households. We can't assume that just because it's been a number of months that everything is safe. and we must take the actions to protect ourselves and our city. We worked hard to put a safer at home order in place, and we worked hard to bring down our R0, or our infection rate, to less than 1 or about 1, which meant that every person who got COVID-19 only infected one person or even slightly less. That's what helped us not only bend the curve, but start to push it down. Now, our infection rate is increasing again. It's estimated to be at 1.26, not as high as when it was at 3 or more at the beginning of this, but worrying and increasing. We are closely tracking the positivity rate, that is, the rate of positives for every COVID-19 test that we do. It was as low as 4.6% in late May. Today it stands at 8.7% countywide. In fact, 6 of the 7 indicators that we track to see what is coming around the corner are headed in the wrong direction. Only deaths continues to go down, and we know that's a lagging indicator, sometimes 2, 3, 4 weeks behind where we are today. Many of the individuals who have recently become infected, as I shared with you last week, are younger, 18 to 40-year-olds, who are now at least 40% of those infected, up from just 33% a month ago. And it remains critical that everybody, no matter what your age, owns taking control of this situation. We're also very closely monitoring our hospital capacity, because that's what we are fighting against, making sure our medical workers and our medical facilities are not overwhelmed, so that we don't lose more lives with frontline workers, so that we have the capacity to save lives if people have bad cases of COVID-19, especially our vulnerable, those who are elderly, those who have pre-existing medical conditions. Today there are 849 beds, including 703 acute care beds and 146 ICU beds. This is fewer than we've had in a while. And while we can surge up again, and we may need to do that to build our capacity in hospitals and our convention center and other places, and we have an available inventory of ventilators today at 1,147. Again, this is in our hands, not just the hands of medical professionals. Hospitalizations are rising. They've now reached 1,732. We were averaging about 1,400, so now we've increased almost 20% above that. This is the highest number of hospitalizations since the height of the pandemic, when we were at 1,900, and our county projects that we will be at that old peak in just about 1 week. It's a 27% increase in just 2 weeks. We must not get to the place where COVID-19 overwhelms our hospitals. These projections are sobering. But I want to remind you, certain things remain strong because of you, because of the work that we have collectively done in and outside of government. Our testing capacity is among the strongest in the nation. Our contact tracing continues to grow. And our testing program at congregate living facilities has cut by more than half the number of deaths of people who are at skilled nursing facilities, because we went in there strong, and we're saving lives. Last week I ordered more tests as demand surged at the beginning of last week to meet the demand, and in this past weekend 18,500 people were tested. In fact, now more than 1 million people who live in the county of Los Angeles have now been tested through our centers. And now we have the capacity to test 18,700 people at 23 city and county facilities, in addition to 82 other locations like your neighborhood CVS pharmacy or community health centers that now offer testing, and of course through your healthcare providers, which we want to remind people can also do tests when you have symptoms. But whether you have symptoms or not, you can get a test through a city, county facility, and I'll remind you one more time, it's at coronavirus.lacity.org/testing. Results are coming back an average of 1 to 2 days. We are able to meet that capacity, including in the largest testing center in the United States of America that we know about at Dodger Stadium. And in addition, we've added nearly 300 City of Los Angeles employees who I want to thank for stepping up as frontline workers to be contact tracers under the supervision of our County Department of Public Health and Dr. Barbara Ferrer, who's been doing, together with her team, an incredible job tracking and tracing. As a member of the contact tracing team reaches out, it will appear on your phone as LA Public Health. Please answer the phone. And another thing I want to say too is some folks are not reporting many contacts. They're only saying 1 or 2 names. Maybe they fear being fired at work. Maybe they think it's going to go to other government officials and betray their status in terms of their immigration status. These things are false. We need you to just tell us so we can tell the other people who might be infected to quarantine themselves and to stop the spread. This information isn't shared with anybody. It is your health care privacy protected right. And we will continue making sure we can stop the spread together when we let those health professionals know, everyone we've been in contact with, so we can then let them know to stop this. We're making decisions always based on the latest data and guidance from public health experts, from doctors, from public health professionals. And if necessary, I've said we will always change course to save lives. Confronted by this data, it is now time for a pause. And over this weekend, the governor and his office reached out to me, asked me about whether or not we should close the bars, and I said, you have my 100% support doing that. I'd love to see more and more of the economy open up, but we simply cannot endanger people's lives. He ordered bars closed in several counties, recommended in other ones who I hope will heed his warning, and bars that had become dangerous, with many people not abiding by the 50% capacity. Mixed with drinking and alcohol, they became a lethal mix of people crowding indoors across the country. And today, the county announced that beaches, piers, and beach bike paths will be closed over the July 4th weekend, beginning July 3rd through July 6th, and fireworks displays have been prohibited to discourage gatherings. I know how much we look forward to this time of year. I know that we love seeing those firework exhibitions, but not this year. This year we have to think about saving lives, to protect what we have in this country, to protect who we are, and to make sure that our economy doesn't take more steps backwards. Our city and county public health orders, let me review, still prohibit gatherings with people other than those you live with. Getting together with family, friends, co-workers is how the virus spreads. When we get exhausted, it gets strong. When we get lazy, it thrives. It only takes one infected person to spread COVID-19 through your network. We've seen stories of people who decided to have that wedding because it's only 30 members of their family, but they weren't all living together, and now a dozen of them are infected. Workplaces where people thought they could just throw up between workers in a factory cardboard, and they figured that the virus didn't live there, instead of actually putting up plexiglass and distancing people in a proper way, where there's now over 100 cases. We've seen in place time and time again that folks are not abiding by many of the rules that are out there. Those who are not must take control of this moment. And I know the county is beefing up inspections. We've offered to help in any way that we can jurisdictionally to make sure that folks are abiding not by asks, but by mandates that if you are going to be open, you have to abide by. We also, to remind folks, have hit a hard pause on opening any more businesses, such as movie theaters, bowling alleys or arcades, playgrounds for children, concert halls, theme parks, and other entertainment venues. Every day we still continue to learn more about this novel coronavirus. I read today about how it can infect the cells in our brains, and how in Wuhan, China, over a quarter of folks infected had the infection also in their brains. The spaces and places where this virus interacts, where it spreads most easily, and we know that we will always use that information to make tactical and thoughtful changes to protect public health. Gatherings with people you do not live with are not allowed, and businesses need to abide by all, and not just some of the rules. Those mandates are not a menu. You don't get to pick and choose. And where we saw on the third weekend that restaurants were open, still county inspectors say that between a third and a half of restaurants are still not abiding by all of the rules. It might only mean 1 or 2 that you have to tighten up, but for other places, by the third weekend that we are open, please don't endanger the lives of your workers, the lives of your customers, and your own livelihood. Whether you want to think about it selflessly or selfishly, we have to take control of this moment. And I know that the county is talking about taking away those licenses from places that do not abide by those rules and regulations. While the governor and the county and I can issue orders, we can change courses. Fighting COVID-19 is really our collective work. It's not the work inside government. It is like the honor system for all of us. It is the strength of what we did for 2.5 months and must do again. A shared responsibility no matter your age, your religious beliefs, your political views. We have to each do our part. And you know what? I'm confident that you can and you will. But these 2 weeks, as I mentioned, will be defining. And I'd like to remind businesses that we are requiring you to take critical steps to keep everyone healthy. And if you need to refresh what those rules are, go to coronavirus.lacity.org/business and follow the protocols that are there from the county, as well as helpful suggestions on those sites. We educate, we encourage, and enforce. But as long as we keep educating and encouraging, that's where we're going to win this war. Businesses, as I mentioned, don't choose some of them. They have to abide by all of them. And as a reminder, if you have 3 or more positive cases in your place of business in a 14-day period, you are obligated as a business to report that to the county public health department. Let me restate that. 3 cases in your workplace, if you're a boss or an owner, in 14 days, you need to report that so that we can track and help make sure your business doesn't get shut down, make sure your customers don't get sick, make sure your employees don't die. That's how serious this is, so please abide by that regulation. We're seeing people flaunt these rules with institutions and businesses that are over capacity and with folks gathering in backyards. When we don't follow these rules, we are saying we don't care about lives and jobs. My central message is this: whether we continue on this recovery journey is debatable. COVID-19 is taking control, and we need to take control back. So to young people, you are not immune. You can cause great damage, but you can also save a life. We see all over social media, no masks, people partying, doing whatever. And for parents, please take the responsibility. If it's a young person or a child of yours living in your home, make sure you too are helping us in this fight. To the general public, don't get exhausted. Don't let up. Don't start socializing in ways that are not permitted. Especially in these 2 weeks, don't have this moment result in us restricting more of what we can do and what the economy can do as well. And to the vulnerable, my message is very loud and clear. If you're over 65 or you have pre-existing medical conditions, this is becoming an increasingly dangerous time. While it is not mandated, it is strongly encouraged that you stay home during these 2 weeks, whenever you can. If you can stay home, we can make sure that you are safe. And you've always been the most vulnerable. 93% of our deaths are the population that looks like you, that is either seniors or folks that are with pre-existing conditions or both. And we're also seeing this begin to skew as well towards low-income workers in high-density surroundings, either at work or home. We're seeing the Latino infection rate go up dramatically and proportionally is now the highest of any ethnic group. In good news, we brought down the disparity of African American deaths due to the testing that we've surged, the public awareness campaigns that we've done in the Black community, where we saw initially 9% of the county population and 16% of the deaths. That's now down to 11% of the deaths. And we hope to see that keep falling while we also look at this and always look at this through a racial equity lens. To everyone else, please do your part. Stay at home these next couple weeks when you can. Cancel any plans that would have been in violation, or even if permissible, use discretion in this critical time. And to everyone, wear your face covering. Keep your distance. Wash your hands. And remember that we are not powerless. We've been getting help from others and help from each other. For instance, Los Angeles draws strength on our status as a global crossroads in the world. And during these unprecedented times, we've had global partners who love our city, who have helped step up. We've been there for them in the past. They're there for us now. We built bridges and relationships with other communities. Even as others talked about walls, we reached out and built bridges. And we've seen that, whether it's foreign consulates, businesses, individuals, and diasporas from the beginning of COVID-19 that have reached out to help, translating into languages, looking for PPE in other countries. And tonight, I want to acknowledge one of those partners, Vietjet Airlines, which we're hoping will be one of the companies that will be able to fly one day directly nonstop to Los Angeles, who donated 750,000 disposable medical masks to LA. And I'm grateful to the U.S. Embassy in Hanoi and Operation USA for helping make this gift possible. This massive donation is in addition to the 200,000 masks from the Taiwanese American Chamber of Commerce, 40,000 from the Taiwanese Economic and Cultural Office in Los Angeles, and 10,000 from the Vietnamese Consulate in San Francisco. These partners are choosing to donate masks because they know that wearing a protective face covering will save lives. It has done so both in Vietnam and Taiwan incredibly well. So to Angelenos who are wearing a face covering, I say thank you. And to those who are not, I say be responsible. Make sure that you are saving a life every time you wear a mask. Through all of this, we have to remember those painful moments at the beginning of this. We have to remember each one of our loved ones and our neighbors and our fellow Angelenos who have died at the hands of COVID-19. We need to picture those medical workers on long shifts today who are scared about the weeks coming forward. Whether they clean a hospital or whether it's somebody working in a grocery store, they're wondering, what do these numbers that I'm talking about each night mean to them and their family's safety? We have to think about families who haven't been able to see each other, police officers and firefighters on the front line who haven't gone home because maybe their loved one has a pre-existing condition. We have to think about those things that moved us at the beginning of this crisis to reach beyond our grasp, to find our better angels, to dig deep even when we are suffering economically, to do just a little bit more. In other words, to lead with LA love, to find that Angeleno spirit that is in each one of us. We need to reverse the thinking that nobody around us is infectious and assume everybody is. Go back to those pods in our household. Keep our economy moving forward by not endangering the gains we've made so that no more Angelenos have to suffer economically and no more lives have to be lost. I hope that message is crystal clear tonight, my fellow Angelenos. I'm so proud of everything we have done to lead. I'm so proud of everything you have done to protect lives. Let's make sure that that means something. And let's make sure that we take control back from COVID-19 starting tonight. So please continue to do your part by staying healthy and staying safe and staying at home. Strength and love and justice to each one of you. Thank you. And with that, I'll be happy to answer questions.
And our first question comes from the line of Claudia Pashuta from KNX News Radio. Please go ahead.
Hi, Claudia.
And one moment, please.
Okay. Hi, Claudia. You there? Did we lose you?
Relating to COVID. I'm not a public health expert, but given the big reopening after Memorial Day and the mass protests that followed, I expected to see COVID-19 spread grow. We started to see warning signs earlier this month, but you and county leaders proceeded with further reopening, and I'd like to know why. You all keep saying that decisions are based on the data. Given what we know about the data, it was clear that it would take 2 to 4 weeks to see how the late May reopening and the protests might affect the numbers. My second question is regarding the City Hall corruption scandal. Court documents in the cases filed against Huizar and others indicate the alleged pay-to-play scheme has been going on for years. You've been mayor since 2013. Do you take any responsibility for, missing, red flags about potential misconduct at City Hall? Should you have caught this since it was during your watch? Thank you.
Sure. Let me answer the first one. So, first of all, we've followed the data closely. There's not evidence yet that the protest led to much spread, though it's something that Dr. Ferrer has hypothesized, but we haven't seen any conclusive evidence there. We have followed the data, and like I said, this is way below, in most measures, the peaks that we've had. This is about new indications moving forward. And we know that right now, for instance, as we did with farmers markets, with the construction trade, there are things we can do to make sure that we don't have our hospital capacity overwhelmed. But I think all of us recognize that we could not also strangle our economic situation and the prosperity or the suffering of people here in Los Angeles. That was unacceptable. We had unemployment rates above the Great Depression. We had people who were literally hanging by fingernails onto their livelihood. And so we have to balance those two things together. But at these moments when we see indicators, and we've seen indicators begin to come up, we have to take swift action, whether that's closing down bars. I have to remind people, because everybody says, why don't you do X, Y, and Z? The state says what's permissible. The county says what is actual. And as I've said many times, you cannot be a little island in a region. If you keep certain things closed in your city and people can go across the street and work out there, they'll bring that back from a public health perspective. If they go out to dine just next door or across the county border, it will have the same effect, and public health professionals have been very clear about that. The Bay Area has done a better job, in my opinion, of acting together than Southern California, and we're seeing even greater spread around LA County, a higher rate of increase in Ventura, San Bernardino, Riverside, and Orange. Second, we've seen Los Angeles City go down to less than its proportion in LA County for the first time in the last 2 weeks of infections, and LA County go down below half of the state numbers. So I actually think LA City and LA County, through testing, contact tracing, this isn't just about what's open and not, is doing a pretty good job. But we're surrounded also by folks that we don't have walls between us. If you can go someplace else, that is a threat to our public health as well. So I hope that regional leaders will act together on these things, and that the governor will look at a region and not just say, you guys have to close, here's some that suggested, that one is free and clear. I think an area and a region should be mandated by the state or determined by those county leaders together to move together. So, we're well below days. Remember when we had 30+%, even 40% plus increase day over day? We're at 1 or 2%. Deaths go down. We're not at the peak of where we are with hospitalization, and we can surge up more. But these are worrying enough that it is time for us to do a hard pause, to step back on bars, as the county said, on beaches, fireworks, and other things, and then to do exactly what you said, see where we are 2 weeks from now. And as I always said, we're living in the gray. Sometimes we're going to take steps forward and sometimes steps backwards. And I believe in the people who are watching this right now to be able to do what is necessary to continue forward. In terms of City Hall stuff, no. If people want to do bad, I'm convinced there is no way that you can stop them. But they should be prepared to pay the price. And as I've told everybody, I have zero tolerance for the sort of disgusting corruption that we saw in this case and any other cases. And we are all here. This is all our watch. Certainly am not responsible for this, but all of us have a responsibility to root it out. And one of the things I've called for is making sure that people can't vote on land use decisions if they've taken donations from anybody related to or connected to anybody who is before the city. That's the way to finally root out this noxious weed. There's been some good ethics rules that have made it more difficult, but that, like we do at Metro, is the way to finally get rid of that, I believe, here at City Hall. But somebody who wants to break the law, who will always find a way, no. I mean, there's absolutely no red flags that could find that. But I hope that they pay the fullest price. Next question, please.
Our next question comes from the line of Robert Kovacic. Please go ahead.
Hey, Robert. How you been?
How you doing, sir?
Good.
A couple of things. Let's start with in terms of what we will do when it comes to protests that are scheduled for this weekend. And is there going to be some type of guidance for these protests to not continue, given what Barbara Ferrer underlined today, saying that she really does not encourage large gatherings? And also when it comes to enforcement of the closures, Villanueva is already saying that he won't do it. So how are we going to go about enforcing these closures when it comes to the beaches and other places?
So the enforcement of closures is mostly on us. Even if we said every law enforcement officer and inspector goes out there, there are 10 million people in this county. So I've always encouraged each night, as I call it, the 3 E's. Education, let people know what the rules are. Let them know again, let them know again, let them know again. Encourage, where we see people who are not abiding that, whether that's a city employee saying, hey, do you need a mask? Here's a mask for you at a park. Letting people know that, hey, you're out of compliance, you got to tighten things up. And then enforce as your last resort. We're not going to turn Los Angeles into a police state. That's not even the most effective way, according to all the public health professionals, to get adherence to it. So we won't hesitate in workplaces and other places who are very clearly endangering their employees and their customers, whether it's a factory or whether it's a retail establishment, to work with the county to do whatever we can to enforce those public health orders. Again, that's a county jurisdictional authority, but I've offered whatever help with our city staff that they can use, just as we're doing with contact tracers. In terms of the protest, I have not seen any guidance from the county on that. I do think that in general, the main guidance they've said is to keep your social distance and wear masks, but people still can, obviously, and should exercise their First Amendment rights. This is a critical moment not to let up with that. So I've been very proud of people doing that, but anybody who is less than 6 feet from each other, and this also goes for our public employees. People have pointed out sometimes, whether it's folks from our Department of Transportation or Police Department or others, we should all be wearing masks. We should all be keeping our distance. We should all be making sure that we abide by that so that we can protect our First Amendment rights, and we will abide by anything that Dr. Ferrer suggests on that. But again, that's something that's just, that's determined by the county and by the Department of Public Health. But no, I would not discourage people from continuing to have their voices heard, but always do that extremely safely. And in this 2-week period, please use your judgment, and wherever you can, stay at home. Thanks, Robert.
Thanks, Mayor.
You got it. Next question.
Our next question comes from the line of Mary Beth McDade from KTLA Channel 5 News. Please go ahead.
Hey, Mary Beth. How are you? Can you hear me? Go ahead, Mary Beth.
One moment, please.
Okay.
Please go ahead, Ms. McDade.
Okay, thank you. Yes, Mr. Mayor, with the ramped up efforts with the tracking and tracing, I'm wondering just how many in this surge in new cases either participated in demonstrations or had a member of their family or inner circle that did, because I know at the LA County press conference today, they mentioned that it was the actions that occurred 3 to 4 weeks ago. So that's one question. Secondly, I'm wondering, why are the bars being closed when it takes about 2 weeks for the virus to show up once you get it? Bars have only been open for about a week.
Sure. So on the second part, I think it's been clear around the country that these are big public health threats. So places that had been open longer, these are already dangerous clusters where we're seeing these are regularly the places where spread is happening. And couple that with the county inspections that showed many people over capacity and not distancing, it seemed clear what was coming. So it's better to cut that off now before we wait a couple weeks and have it be even worse. In terms of the protest numbers, I keep asking that same question. I don't know if there's a scientific way or not, or if the contact tracers are asking that question, but I'd be just as curious as you, so the county can help give us some guidance, and that gets to Robert's question. Look, it is a sacred right to be able to go out and to protest, use our First Amendment rights, and especially at this critical moment for racial justice. I don't want to in any way discourage that, but I do also want to give people good medical advice. And we don't have any conclusive evidence that it's led to that, but we don't know that it hasn't. So I'm hoping that that will be something that contact tracers can inquire about, can see. So far, when I've asked that question, while Dr. Ferrer said it's logical that that could happen, that's not where they're seeing most of the spread happen. Remember, those are also shorter interactions generally, and they're outdoors. Where this thrives is when you're in a workplace or a home setting for a long period of time, sometimes hours, and that doesn't seem to fit the description of protest. So it might have some spread, I don't want to dismiss that, but it doesn't seem to be the primary place where this is happening. This is happening, as Dr. Ferrer said, probably because we had one pod for a long time, right? Our household. Then suddenly many of us are going back to work, and you've got 2 pods. And then it's that third one, which is maybe the relaxing of whether we should still abide by not seeing people who are not part of our household, the backyard hangout, the place where people are going to a small party. Those 3 things together is what her best theory is why this is spreading. You combine a few different places, and again, to my point where you assumed, look, I've been talking to these people on the phone. They said they're not sick. They got a test a couple weeks ago. I'm going to assume they're not infectious. We've got to get back to the mindset of assuming people are infectious, especially when we heard that sobering number that 1 out of 140 people in Los Angeles County right now are estimated. So, you get together with 3 people, there's a 1 in 50 chance that somebody is infected. You go through a grocery store or work at a grocery store where there's at least that many people, you can guarantee that somebody probably walked through there who was infectious. So we've got to get back to a place where we make that assumption instead of assuming the best. We should assume the worst. Thanks, Mary Beth. Next question, please.
Our next question comes from the line of Dakota Smith from LA Times. Please
Dakota.
go ahead.
Good evening.
Hi, Mayor. I have a question about the city's finances.
Sure.
The city's Budget and Finance Committee today approved a plan to allow nearly 3,000 city employees who are eligible for retirement to receive a cash payout to retire by January. Mm-hmm. And that plan went through the Executive Employee Relations Committee, which you serve on. So do you support this plan? Is this approach better than furloughs? And if so, why?
Yes, I do. I chair that committee, so it moved to the council from a meeting that I chaired with 4 council members and myself. We approved that plan, moved it out, because quite simply it'll save money, it'll save costs, and it can perhaps lessen the furloughs that we have, so provide more service. This year, it's estimated that our separation incentive program, and yes, you get a cash payment, but then we save money by not paying your salary, will be about $60 million this year alone, and about $90 million next year. So over a 2-year period, $150 million of savings, something that we badly need in the worst fiscal crisis that we have faced. We talk a lot about the economic crisis, we talk about the health crisis, the racial justice crisis, but certainly here at City Hall, we do face that fiscal crisis, and together with our labor partners, who I want to thank, just as we did in 2008, this was a smart solution to be able to help reduce some of the furloughs potentially and save the money that we need. But it will depend on how many people sign up. So we're encouraging those who are eligible and who want to. This is a good time to do that, to right-size things and to make sure that we can preserve services, reduce furloughs for those who stay behind, and save money. It seems to be a win-win-win. Thank you. And we have one more in Spanish, I think.
Yes, our last question comes from the line of Victor Cordero from Channel 62, Estrella TV. Please go ahead.
Buenas tardes.
Mayor, buenas tardes. I'm going to ask the question in English first, and then I'll do it in Spanish really quick. I know you're busy.
Thank you.
With the possibility of, we have more cases of coronavirus, with the possibility of closing the city again, are you planning on implementing the order of safer at home again? If so, will there be more help to the people that cannot be going to work because of the order to stay at home? And third, what do you tell the people that are actually working and they don't like the idea of closing the city again? Si nos puede decir brevemente, con el aumento de números de casos, ¿existe la posibilidad de que implemente la orden de permanecer en casa una vez más? De ser así, ¿habrá más ayuda económica para la gente que no puede ir a trabajar? ¿Y qué le dice a la gente que sí está yendo a trabajar y que no le gusta la idea de cerrar la ciudad?
Thank you. Well, first and foremost, none of us want to go backwards, which is why this message is so important tonight. We still are in a safer at home order, but maybe you're referring to as strict as it was at the beginning, with some of the openings being reversed. As I said, I think we've gotten smarter, and we know better how to beat COVID-19, how to slow its spread. And if we remember those basic things of keeping distance, washing our hands, wearing a face mask, and by the way, workers should know their rights at their place of work, that if they have an employer who isn't providing them with facial equipment, a place to wash their hands, all of that stuff, that employer is in violation and putting them and their job at risk. So I believe that these next 2 weeks we can ensure that this is a pause, and besides the bars and maybe a couple other small things, there aren't any big steps backwards. Because to your second point, I don't think that the federal government necessarily is going to be there again, and the federal government forgot many Angelenos, didn't help immigrants or people married to immigrants or the children of immigrants in our city. We saw people who were part of the so-called gig economy who didn't get the same assistance as others. We have to stop COVID-19, and we have to help people economically. But I'm very proud that in a couple weeks we'll have more assistance, $100 million in rental assistance. The Angeleno card is well over $20 million distributed, and we're going to keep going. And looking at help for businesses to be able to pay their employees and to be able to keep going even if folks have to stay at home. So I'll say that also in Spanish, but to those who would be opposed, I would just say, I agree with you. I don't want to close anything either, but I also don't want people to die. And that's up to us, not up to a mayor, but up to each one of us. En español yo quiero decir unas palabras. No quiero cerrar más en la ciudad de Los Ángeles. Y tenemos el poder a continuar con la reapertura de esta economía y la sociedad en Los Ángeles. Pero necesitamos a continuar con los pasos a mantener su sana distancia, siempre a tener una cobertura facial, etcétera, para continuar en este camino adelante. Es muy peligroso para todos nosotros y yo quiero decir a la gente de Los Ángeles, los empleados de las compañías aquí, ustedes tienen derechos. Es muy importante en sus lugares de trabajo que su dueño, que su jefe tiene las coberturas faciales para ustedes, que nosotros tenemos los recursos que necesitamos para lavar las manos, etcétera. Sin estas cosas, su compañía, su lugar de trabajo es en violación de este orden de la ciudad de Los Ángeles. Y por los trabajadores que no quieran regresar a un cerrado de la economía, yo también. Pero estos aspectos de nuestras acciones cada día son críticos, especialmente en estas próximas 2 semanas, porque hay desafortunadamente muchas indicaciones que el número de casos, el peligro de este momento está aumentado. Pero yo tengo confianza en la gente de Los Ángeles y en mis palabras por esta noche tener más detalles de estas acciones que nosotros podemos tomar a proteger la comunidad, nuestras familias, nuestros trabajos y nuestra ciudad. So with that, I'm going to turn to answering that in even more detail and updating all of our Spanish-speaking Angelinos on this. Thank you to everybody tuning in. Thank you for the work that you will do. And please, please go back to that mindset that we had just a month and a half ago, 2 months ago, of what we can do. And let's get through these 2 weeks and show that LA spirit alive and well again. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche. Les he prometido que siempre sería honesto con ustedes sobre el gran desafío delante de nosotros. Tenemos que enfrentar la realidad. El COVID-19 todavía está aquí y todavía es mortal. Es tan serio hoy como lo era cuando primero apareció. Este fin de semana supimos que el número de casos COVID-19 global sobrepasó 10 millones y han fallecido más de 500 000 de personas en el mundo por causa de este virus. Y estamos viendo que los casos siguen subiendo en los Estados Unidos, en California y aquí en Los Ángeles. Ayer el gobernador Newsom ordenó el cierre de los bares en varios condados del estado, incluyendo Los Ángeles, con mi apoyo. Y hoy el Departamento de Salud Pública del condado anunció el cierre de las playas, los muelles y senderos de ciclismo durante el fin de semana del 4 de julio, empezando el 3 de julio hasta el 6 de julio. Junto con la prohibición de fuegos artificiales para evitar reuniones. Todos quisiéramos celebrar el 4 de julio, Día de la Independencia, como antes, pero este año tenemos que cancelar nuestros planes y tomar las precauciones necesarias para mantenernos seguros. Las órdenes de la ciudad y del condado no permiten que se reúnan con alguien fuera de su hogar. El reunirse con familia y con amigos ayuda a propagar este virus y solo necesita que haya una persona infectada para empezar la propagación en la comunidad. Además, hemos tomado una pausa en abrir más negocios como teatros, boleras, salas de juegos, parques infantiles, salas de concierto y parques y otros sitios de espectáculo. Sabemos exactamente lo que es necesario para mantenernos seguros. Evitar reuniones, lavarse las manos con frecuencia, llevar una cobertura facial y mantener la sana distancia. Hacerse la prueba de detección también es crítico. La semana pasada yo ordené más pruebas para poder satisfacer la alta demanda y este fin de semana le hicimos la prueba a 18.500 personas, en total más de 1 millón de personas en el condado total. Hoy tenemos la capacidad de hacerle la prueba a 18.700 personas en 23 sitios de prueba, además de 82 sitios adicionales en su farmacia local de CVS o un centro comunitario. Por favor, visite la página coronavirus.lacity.org/testing para más información y una cita ahora. También estamos monitoreando la tasa de positivos, la cual ha subido al 9%. La tasa más alta antes era 15%, notando que anteriormente había menos personas haciéndose la prueba de detección. Una gran parte de personas positivas ahora tienen entre 18 y 40 años. Entonces es crítico que todos tomen las precauciones para cuidarse. Además, estamos monitoreando nuestra tasa de infección. ¿Cuántas personas por promedio infecta cada persona positiva? Ahora nuestra tasa es 1.26 y este número elevado es la razón por la cual tenemos que tomar acción ahora para frenar el brote. Hoy el condado nos informó de 2.903 nuevos casos. En total tenemos 100.772 casos. Y una persona entre cada 140 es infectada con el COVID-19 en el condado de Los Ángeles ahora. Y puede infectar a quienes están cerca de ellos. Ahora es muy probable que se encontrará con una persona infectada durante su día normal. Y en esta próxima semana, este nivel probablemente será una persona entre cada 70 personas es infectada con el COVID-19. Es muy peligroso. En la ciudad tuvimos 1.221 nuevos casos, llegando a un total de 44.189, el número más alto que hemos tenido. Y tristemente, fallecieron 22 personas más en el condado, llegando a un total de 3.326 fallecidos. En el condado tenemos 849 camas de hospital, entre ellos 146 camas de cuidado intensivo y 1.147 respiradores disponibles. Estos números son muy fuertes, pero tenemos 1.732 hospitalizaciones. Este número ha subido y es el más alto que hemos visto durante esta pandemia. No podemos permitir que nuestros hospitales sean sobrecargados por el COVID-19. Podemos cambiar las órdenes al nivel del condado o al nivel local, pero la lucha contra el COVID-19 es nuestra responsabilidad, compartida. No importa su edad ni su posición política, todos debemos hacer nuestra parte en esta lucha. Esto significa cooperando con el programa del condado por la localización de contactos, lo cual nos ayudará a identificar personas quienes han estado en contacto con personas infectadas y limitar la propagación en la comunidad. Si alguien de este equipo te llama, aparecerá LA Public Health en su teléfono y por favor responde a esta llamada. No son agentes de policía ni les preguntará de su estatus migratorio, solo le preguntarán sobre sus últimos contactos. También significa llevar una cobertura facial. Esto es un señal de respeto y amor que ayuda a salvar vidas. Estoy agradecido a todos quienes llevan una, y si no llevas una, póntelo ahora. Y le recuerdo a los negocios que visiten la página coronavirus.lacity.org/business para conocer los protocolos para proteger a sus empleados y a sus clientes. En esta nueva realidad con COVID-19, hemos tenido que cambiar la manera que celebramos y cómo lamentamos. Este fin de semana no podremos celebrar el 4 de julio como lo hacemos normalmente con familia y amigos. Pero este año tenemos que hacer nuestra parte para protegernos a nosotros y a nuestra familia y a nuestra comunidad. Con tomar precauciones, estamos ayudando en preservar el futuro de nuestra ciudad y nuestro país. Entonces, por favor, hagan su parte para mantenerse saludable. Quédense protegidos y, por favor, cuando puedan, quédense en casa. Fuerza y amor y justicia, Los Ángeles. Gracias y buenas noches. Thank you all.